Oh, wow. That's a new verbal greeting as well. Well, good morning, everyone. Welcome to the June 16th, that's hard to believe, 2021 meeting of the Fairfield Cares Community Coalition. Kristen McCarthy-Vahey, and I'm really grateful to be here with everyone this morning, especially post-graduation. And want to say a special thank you to Mr. Cummings and our Board of Ed member Jacobson and our former Board of Ed members and all of our teachers, staff, and support folks who helped get our kids to this place safely. And I believe tonight, if I have my days correct, is Ludlow's. So it's pretty amazing. And I know I just want to thank all of you for your ongoing support for the young people of our community. So first up on our agenda is introductions, and we always start with a brief introductions, and we'll go around and end with Mr. Cummings, who can then give a co-chair update. So start with Kathy, then Nicole, then Bernadette.
Good morning, everyone. Kathy Hazlett, employed by Positive Directions and the Coalition Coordinator for Fairfield Cares.
Thanks, Kathy. Nicole?
Hi, Nicole Wachowski from Mothers Against Drunk Driving.
Welcome, Nicole. Bernadette, and then Bill.
Hi, I'm Bernadette Capola. I am a parent of two late graduates from Fairfield School System, and I am the treasurer.
Morning, everyone. Bill Haas, representing both the Rotary Club of Bridgeport, but also Sacred Heart University Center for Nonprofits.
Thanks, Bill. Phil, and then Jennifer Dixon. Oh, Phil, you're muted.
Phil Dwyer, Chair of the Resource Committee.
Thanks, Phil. Jennifer, then Vicky.
Morning, everyone. Jen Jacobson, parent in the district and BOE member.
Thanks, Jen. Vicky, and then Riney.
Vicki Gustafson, representative for the Kiwanis, parent of two grown children who have children, and a teacher of an alternative high school for over 20 years, and glad to be here.
Thank you. Riney, then Wendy.
Good morning, Riney Noor, Fairfield Cares Social Media and Programming Coordinator, parent of 4 Fairfield Public School graduates as of yesterday. So this feels really strange and good at the same time. And I echo Kristen's comments from earlier. Thank you for everybody. Especially I had a graduate this year and last year. So I can count myself with that small parent group with 2 Corona graduates. So thank you very much. And yeah, I'm just continue to be very passionate about keeping our kids safe. So I'll stick around.
Yay. Well, that's relief to hear and wonderful. Wendy, and then Steve.
Good morning, Wendy Benevegna, and I'm afraid, and Pippin, who just, if you see me jerking, it's because my cat is participating. A parent, community member, parent of 2 children who graduated many moons ago, but a longtime volunteer, sticking around and work on the LPC grant.
Thanks, Wendy. Steve, then Lori.
Am I the only Steve on this one? Hi, I'm Steve Bogan, parent of 2 graduates from Ward, college grad now, and 1 in college. And a parent sticking around, looking ways to help too, like Wendy and Bernadette, some of the others.
Thank you. Lori, then Alita.
Good morning, everyone. I'm Lori Mediati, parent of Ludlow grad and pre-K through 12 health education coordinator for Fairfield Public Schools.
Thanks, Lori. Alita, then Diana.
Hi, I'm Reverend Alita Ward at Greenfield Hill Congregational Church. Co-pastor here with my husband and very involved in youth work at our church and also head of the Fairfield Clergy Coalition.
And
hi.
Oh, Diana, go ahead. Sorry.
Hey, good morning, all. Diana Letek, the Executive Director of the Fairfield YMCA.
Thanks, Diana. Margaret and then Allison.
Sorry, I'm muted. Hi, everyone. I'm Margaret Watt. I'm the Prevention Director of Positive Directions. And unfortunately, I have a meeting that I have to get to by 9 a.m. So I'm going to be signing off almost momentarily, but I just wanted to congratulate everyone on such an amazing year, and especially on Kathy on her incredible work.
Yes, hear, hear. Thank you, Margaret. And Allison, and I see actually Santina's unmuted. So Allison and then Santina, if she can talk.
Hi, I'm Allison. I'm a social worker at Fairfield Social Services for the town of Fairfield, and I have kids at McKinley.
Thanks, Allison. And Santina, I don't know if you're able to speak, but if, oh, there you are.
Yeah, so I don't know if you can hear me, sorry. Santina Durango, health educator for the health department.
Wonderful. Well, thank you all so much. And I would echo what Margaret said. What a year we've had. There's been a lot that's been accomplished. And of course, there's still a lot to do, and we have a lot on our agenda. I will end with moving on to the last introduction and our co-chair update from our wonderful superintendent, Mike Cummings, Mr. Cummings.
Thank you, Kristen. Good morning, everyone. Mike Cummings, Superintendent of Fairfield Public Schools. I am so glad to be here this morning, and especially to hear all those of you with who are willing to stick around. That's my best news of the day so far.
Yeah.
Last night, as it was mentioned, we had Fairfield Ward graduate tonight as Fairfield Ludlow, and if you were there, you would see that there was a great deal of optimism in the community. Nothing like a high school graduation in a good year to bring a great sense of optimism to the community, but in this, particularly over the past 16 months or so, the graduations have really resonated, I think, for all of us. The hope that our students bring to us about the future and their really meaningful reflections on their time in this community, not just in the schools, but in the community as a whole, really speaks to the value of the unity of our community around our kids. And that was again apparent last night, and I'm sure we'll hear much of the same at Ludlow tonight. And as much as I hear it, it never fails to matter. It's great to hear. So I want to thank everybody who's contributed to that, because Fairfield Public Schools does not ever do this work alone. With that said, I have seen a preview of Kathy's presentation, and it's a really important one for us in the school system. I would just preface it by saying that she'll be presenting this to the Board of Ed on Tuesday night. I'm going to be sharing a copy of this with our administrators as they begin to work on their schoolwork this summer, get ready for the next school year. Like all of us, we're in a period of time of reflection on where we've been and how it's going to impact where we go. Kathy's the survey that Kathy's going to talk about really gives us a sense of where our kids are right now and how we as a school system and as a community need to respond to that in our moving forward. You know, there could be a temptation, I think, we see this in sometimes on Saturday nights, people are rushing to the future. But if we don't take stock of where we are and how it's impacted us, we're going to make some critical mistakes. So with that said, I think that's right. Is that the next agenda item? I just set it up. I apologize.
Yeah, if I could just add one other thing to underscore what Mr. Cummings just said before turning it over to Kathy, that we clearly have a tremendous partner in Mr. Cummings and Dana Basio and so many others, leaders in the school system. But we need to continue to underscore that this is truly a community effort, a community-wide effort, that the schools are a key aspect and part of that, our parents, but our entire community. And that's why it's so great to see so many different community representatives here. So with that, we can turn it over for agenda item number 4, which is talking about student survey results. the 4 core measures and supplements. And just to give a preview of that, I know Kathy may say this as well. Traditionally, we start with the Board of Education and presenting information. Because of the timing of this, and to Mr. Cummings' point about how important this is to guide our work as well, alongside the board and other community organizations, we wanted to make sure people had it. And with that, I will turn it over to Kathy.
Thank you. I think out of deference to the school and to the Board of Education, I wanted to focus my presentation to the coalition just on the 4 core measures and the supplemental survey. I'm also, as I was working on this last night, I realized I'm gonna defer the parent survey to another time because it's just too much for one meeting. It's just too much data, I think, for everybody to take in. So because there's a lot just to discuss around the substance piece of it. And I'm more than happy, once I've shared the developmental relationship portion of the survey with the board, I'm more than happy to make that available to coalition members as well. But let me share my screen. I truly appreciate the partnership that we have with the school to be able to do the survey. Let me just get to, okay. I'm gonna minimize my, okay. Can everyone see that first slide? Somebody say yes.
Yes. Yes. And if you want
okay, thank you.
slideshow, then we can see the full screen too.
Okay, great. So we used a different survey this year, just some background information in the past, and we've been doing surveys with our 7th through 12th grade youth just about every 2 to 3 years, even before the coalition was formed in 2009. And we so appreciate this relationship with the school. RIASAP, which is now sort of the parent organization of the hub, our regional behavioral action organization, was administering the survey with the school several years ago. And then, you know, as grants became available, as money became available, and as the coalition formed, you know, the coalition took it on as sort of the predominant partner with the school to make it happen. This year, we used the developmental relationship survey just to take a look at relationships between students and teachers and from the student perspective. And I think it'll be a new orientation for many teachers, and for some it'll be very reaffirming to know that, yeah, we're doing a pretty good job. Positive Directions was the physical agent for the grant that funded our survey, which was funded through the underage drinking grant that's been funding me for this past year. The surveys are typically administered toward the beginning of February. This year, because of the pandemic, we ran into several obstacles to keep that schedule. In February, sadly, the school and the community experienced the death by suicide of a young person. So that was tragic and was certainly not the right time to be administering a survey. Time went by, we were ready to administer remotely to students. And then it was decided to bring the students back. So we wanted some transition time to allow the students to acclimate themselves being back in school. And so the survey was administered during the last week of March. And to grades 7 through 12, a random selection And we're going to talk about sort of the aggregate. No data is able to be specified to a specific person. Parents have the opportunity to opt their child out of taking the survey, which has always been the case. It's something that we've always felt was really important. Parents did know about the survey a good week or maybe 2 weeks before it was actually administered. And we provided quite a bit of detail in a letter to parents about the survey. In terms of the demographics, our goal was to survey 2,400 students. Didn't quite make that. And I think for a couple of reasons. One, I think it was just a challenging year. It was just tough to add one more thing, I think, in some respects. Not all students were back in school, and so this was primarily administered in school. We did administer or have more students complete the survey this year than we did the previous time. So the more students that we can have complete the survey, the results are obviously going to be that much more robust. And let's see, so we had a pretty good split between the two genders, a fairly good representation among the diversity of our population. We are predominantly white student body, but that diversity is growing. So just to launch right into one of the core measures is past 30-day use. And this is just looking at this year's data. As you know, in our Drug-Free Communities grant, we've identified alcohol and marijuana as our two substances that we hope to work on. And we hear about that grant, by the way, around August 30th. So it's going to be a while, but we've made it through the first hurdle. The CDC, we know, has our grant application. So, so that's a good, so what you see here is pretty typical. And this is what we see every time we administer a survey is youth use of substances increases as students make their way through the grades. So clearly by senior year in high school, we're seeing the highest percentage of students who are using substances are seniors. Alcohol remains our most predominant substance. Then I would say, you know, it's a toss between the vaping and marijuana. Now, something I want to point out is in this survey, Search does not distinguish, when they ask about vaping, they did not distinguish between vaping nicotine or vaping marijuana, THC. So it was all kind of lumped together, and that was stated actually in the question. So when students were responding to vaping, they knew that they were responding to vaping nicotine or THC. So I'm actually not surprised that we're kind of seeing, particularly from 10th to 12th grade, sort of a similar trajectory for those two substances. RX drugs, misuse of prescription drugs has never really been on our radar in terms of a problematic issue. It does seem like this data is slightly more than, it's usually like 1 or 2, and we're seeing some 3s. And this is percentage, by the way. This is percent by grade. And tobacco, blessedly, is remaining low. So happy to see that. So let's look at how alcohol compares with our previous year. And so when I'm looking at this data, because this was such a unique year, we did see, quite frankly, some, I think, fairly significant improvement in the past 30-day use. Now, the question is, why are we seeing that? It would be great. It would be wonderful if we can say all of our prevention efforts are the reason why the numbers are coming down. However, we also know that because students were not together as much, they were not in school, they were not gathering together on the weekends. Therefore, the parties weren't happening, the opportunity to, exchange dates, etc. The access to substance was not as great as it might be. However, 2 years from now, when we resurvey, it will be interesting to see how those data compare with 2021 data. So our goal with the underage drinking grant was to bring that 30-day youth alcohol use down to 20%. Well, it got down to 15%, which is great. Middle schoolers, I'm actually a little concerned about our group of middle schoolers because as we kind of go through the data, I was feeling like I was seeing more use than what we've seen in previous years. And then, it went up slightly in terms of alcohol use for 7th and 8th grades. High school went down significantly. Our seniors, though it went down significantly in our senior class, but again, there's this huge jump between, let's just go back. There's always a jump of substance use from 10th grade on, because once kids get their license, there's a lot more freedom and independence. We also see there's a lax of attitudes in both parents and students by the time students get to their senior year. For some parents, and this played out in our focus groups, we're hearing, particularly around alcohol, parents feel that their child needs to be taught how to drink before they go to college or move on to the next phase of their life. And Nicole from MAD has said in a wonderful presentation we did earlier, why do we feel it necessary to teach our kids how to use a drug when we, how to teach to use alcohol when we don't teach them how to use any other drug, which I think is an incredibly important statement here. Actually, let me do this. I can go to slideshow. Okay. There we go. All right. Let's see. Risk. So the second core measure is looking at perception of risk of a particular substance. When it comes to alcohol, we look at binge drinking. Binge drinking is considered 5 or more drinks. On average for guys, it's typically 5 drinks. For women, it's 4 drinks, all that, depending upon the individual. We're looking at drinking 5 or more drinks once or twice a week, which is significant. So unfortunately, we want the perception of risk. This should be a high percentage. We want kids to see that, yes, there is harm in drinking 5 or more drinks once or twice a week. The fact that it went down a little bit is a little concerning. That may be because they're seeing perhaps their parents drinking more. And we do know that sales of alcohol went through the roof during the pandemic. Package stores were doing a booming business throughout the pandemic. So alcohol was at home more than maybe it had been in the past. Students might be seeing their parents drinking more. It'd be curious to kind of explore what's behind the data. Also, just to see that our 7th grade, I thought this was sort of interesting. Our 7th graders actually perceive the risk of drinking less than the 8th graders. And 75% and even 82%, I think, for middle school. That seems to me to be a low percentage. I would have, I guess, hoped that would have been a higher percentage. And then you can see the difference actually, again, as we go through the high school years, it's not surprising that by the time they're seniors, that perception of risk has gone down pretty dramatically. Marijuana, past 30-day use. Went down overall pretty significantly. No change in middle school. It's always been a pretty small percentage. Be great to get that even lower. But at high school, this is really interesting to see. And again, I think this is about the access. We weren't out and about as much. People were not interacting. So I think that might be what's going on here. But again, we'll know more in 2 years from now, actually. And then you see the range between the grades in high school. If you have any questions, feel free to speak up and ask as I go along. We'll also do questions at the end. Perception of risk of alcohol went down. It's also the lowest of all the substances we look at. Sadly, marijuana is perceived to be the least risky. And to me, that tells me as a prevention specialist, that's more education that we need to do. So the fact that 61% of our middle school and high school students perceive marijuana use once or twice a week as not, as risky, and that's the only percentage is somewhat alarming to me, I have to say. Went down in middle school, and interesting, went up a little bit in high school, but not up enough. So we need to keep working on that. Vaping. So again, from the search survey, they were asking, it was a combination of, do you vape nicotine or marijuana? And it was nice to see that overall that went down a bit in the middle school, because let me explain this slide. So in 2019, search did not inquire about vaping at all. We did ask about it in our supplemental survey in 2019. So this is where you see sort of a difference in the data. So 7% of high schoolers are saying that they vaped either nicotine or marijuana, compared to 16% who vaped nicotine in 2019, 16% who vaped THC. Again, I think this is speaking to the lack of access to substances, because we know in the school, kids are exchanging pods, they're exchanging substances, so they just did not have the access, but that's just a hypothesis. Perception of risk. 81% of 7th through 12th grade students considered vaping, again, nicotine or marijuana, as risky behavior. In 2019, 69% viewed nicotine as a moderate or great risk, and that was from our supplemental. So again, it was not asked on the search survey in 2019, and we're just inquiring about vaping nicotine in 2019. So it's nice to see that perception has gone up, but we still want to make it higher. Not sure what happened to that. Oh, okay. That's a surprise. Didn't know the slide was going to do that. Okay. So in the two other core measures are looking at student perception of what they think their parents are viewing toward youth use of substances, and then to student perceptions of their peers' disapproval of substance use. So in our survey this year, almost all students reported that their parents disapproved of drinking, of vaping, and slightly fewer reported parents disapproving of marijuana use. Regarding peers, again, most students report that their peers disapprove of substance use. Not surprising that this is a lower percentage than what they perceive their parents' view of their use. Again, by senior year, there's generally a significant decrease in the perception of peer disapproval of substance use. 66% alcohol, 63% for vaping, and only 47% for marijuana. So again, a lot of education we need to do around marijuana use. So ever use, this is, have you ever tried? Maybe you didn't use any substance in the past month, but curious to know what's the percentage of students who completed the survey ever tried any of these substances. So you see that this is all significantly higher than in past 30-day use for the most part. And I think it's important for you to see, ever tried in middle school. That's when the experimentation has a tendency to begin. It would be great to bring these numbers down. I think, quite frankly, that we're seeing 4% of our middle schoolers have misused a prescription drug. I feel like that's something that we want to look into a little bit. A little more than 5% have tried vaping. And that's, that would be an e-cigarette. So in our supplemental survey, we were inquiring about vaping nicotine only. And we know that it actually starts in the upper elementary grades. In high school, roughly a quarter of the high school students have tried drinking. A little more than 10% have tried marijuana. Very few have misused prescription drugs, and roughly 9% have tried vaping. I think the message is beginning to get out about the vaping, at least of nicotine. At least that's what I'm beginning to hear from young people. But, that's to be explored some more. All righty, 93% of students do not vape nicotine. So the vast majority, in other words, when we're looking at vaping specifically, vaping nicotine, most of them are not vaping nicotine. Not to say that they're, of those who vape, perhaps they're vaping THC. We need to explore this some more. So it's somewhat concerning to me is of those who are vaping, they're vaping once a day, maybe even more than once a day. And then I would say the others, it's a pretty small percentage that they may take a rip off a vape, less than once a week even. But it is something that we want to keep taking a look at. And we know that nicotine is one of the most addictive substances. Marijuana is also addictive. So we hope that even 1.6% doesn't seem like a lot, but we just want to keep that, down to zero if at all possible. When asking specifically about perceptions of parent and peer disapproval of youth vaping nicotine, 96.1%, slightly less than the 97% reported earlier, reported parent disapproval, and 73.9% reported peer disapproval. And this is specifically around vaping nicotine. So interesting that it's a little less than all other substances. Access. 96.3% of students, all right, hold on, I just did that. Hold on, okay, there we go. So access to substances, we wanted to know how did students feel? Is it easy to access? Is it hard to access? When it comes to alcohol, it's pretty evenly split. But of all the substances though, alcohol, not surprisingly, frankly, it's probably the easiest to access.
Is the suitcase ready to come down?
Yeah,
but I'm packing one of the
So,
Is there a question?
Just hang on one second. Go ahead, Kathy. Some folks weren't muted. I think Bryony muted all of us. Keep going.
Oh, okay. Okay. So I thought it was just important for you to see sort of the landscape of how students viewed access to the various substances. Let's see, anything else that I really wanted to point out? Marijuana in the high school, for the high school students. Right now it's roughly 2/3 consider marijuana pretty hard to access. But that 30% there is somewhat alarming. As in the vapes too. And why is vapes considered easy access? And I think that's where and this would be the next slide, where they're getting it. And let's see if I can. Okay, no, I guess that's, all right. So where are they getting the substances? And I think sometimes it's better to look down rather than across necessarily. So when you're, taking it from home, 83.3%. All right, to me, when it comes to prescription drugs, taking it from home, all right, maybe we need to do a better job educating around the safe storage. We do our drug take back days twice a year. So the fact, even though it's a small percentage, if we think back on the percentage of students who misuse prescription drugs, but for those who do, we want to be sure that we're doing everything we can to provide safe storage at home, to remind parents to either lock up the medications or put them where they, children can't access them. From a friend is, as we look at marijuana and vaping, and again, prescription drugs seem to be the primary way that youth are getting those substances is from a peer, from a friend. I can't see. My sharing your screen thing is in the way of seeing those bottom percentages for prescription drugs, but also, as kids are getting together, at a party, gathering with friends, that's also another significant way that youth are accessing. So this is helpful as we are putting together strategies and having to think through how do we want to address access. Knowing this is really helpful information. Can't move on.
I think looking at the prescription drugs, that 33.3 get them on the web or through social media, that is certainly a number we need to keep our eyes on.
Thank you for pointing that out, Rainey. Yes. All right. Not able to move on. Why can't I move on? Let's see. I think my screen has, oh, okay. All right, oh, and there you go. All right. So I'm just gonna minimize, or I will start on sharing. Any other questions on that? Pretty comprehensive. And I'm going to be sharing some of that information with the board next Tuesday, but I'm not going to get in as much into the supplemental because I'll be focusing on the developmental relationship data with the board.
Kathy,
Yes.
if I may, just again, for anyone who might watch, but just a review, those 4 core measures, those are standards that are used nationally, and that's what we've used for many years in terms of survey data, that past 30-day use, the perception of risk, the perception of parental disapproval, and perception of peer disapproval. When we talk about, what it says on their agenda, those are the 4 core measures. And and just for purposes of our agenda, when you talk about supplement, just briefly kind of frame that in terms of what survey data is out there and what those main buckets are, even though we're not doing the parent survey. If you could just do that for a brief moment, in a minute or so, just to frame it.
Yeah, so the supplemental survey, because we know that search only inquires about those 4 core measures, we want to know more than just that. We want to know something about how youth access these substances, which is why, and we want to know how easy it is. So those were specific questions that we wanted to inquire. We also wanted to know ever use, because while past 30-day use tells you about essentially current use, it's a snapshot, and that ever use gives you a bigger picture of what really is the landscape of youth use of these substances. So it's helpful for us as we then bring together, other data elements, either from focus groups or, school data, law enforcement data, looking at all of this in aggregate. It helps us to identify what are the appropriate strategies for our children and for our community that would be most effective. So.
Thank you for that. I think it's helpful. And I think then we also have the corresponding parent survey data, and it really speaks to why we need to continue to engage with the data and having the data folks working committee, because there's so much here and it's really great to have the data. And what we do is take it and use it to make decisions about how we direct our resources, how we invest our time, what education we need to do, what programming needs to be provided, what community connections we need to make.
So I think what I'll do for one of our first 2 meetings in the fall is share the parent data and how that compares with our youth data. So we ask parents their perceptions of youth use, and it's interesting to compare that with what students are saying. So that's always a helpful comparison. And I think that'll be a nice way to kind of launch our next year.
Are there other questions before we?
Vicky has raised her hand.
Oh, thank you. I'm out of Zoom practice, clearly. Vicky?
Hi, yes. My question is, what effect, if you're talking about who approves, who doesn't approve, when the state of Connecticut is legalizing marijuana, how is that affecting our children's viewpoint on, how dangerous it is, that it's, something that they could get hooked on? Before, everybody kept saying, oh, you can't get hooked on it. Now, I hear you saying that they can't, it is addictive. So how is the state going to affect the view our children take? Thank you.
Yeah, I think that they're already, because we've got medicinal marijuana, there's mixed messages that I think kids are receiving already around cannabis, and the National Institutes of Health has clearly done the research and shows how cannabis can be helpful for certain medicinal purposes. And then we've got the CBD, that's also a
No, this is
oil.
recreational. Sorry, this is
Yep.
recreational, stated clearly, recreational.
Right.
Whatever that means.
I'm getting there, Vic. I'm getting there. I'm setting the stage. So I think that once cannabis is legalized in Connecticut, it will really be incumbent to be sure that the safeguards are in place to protect youth from access to. There's no question that we're going to need to do a lot of education to parents and to kids about the risks, the dangers involved. It does present more challenges, there's no question, but we will do the best we can with the environment we're given. And I think that's where a lot of education is necessary. And the safeguards need to be put in place around marketing of the product and access to. So a lot of those details are to be worked out.
Well, why can't we then instead just tell our legislature not to do that? And we've been trying to tell them and they're just poo-pooing it. I don't want to get political. I'm just saying, this is affecting, they made alcohol's legal for adults, but look how access is for the seniors and the high school kids. They've got plenty of it. The same thing's going to happen in my mind with the marijuana. I won't say anymore.
So Vicki, I'll respond to that because I am a legislator, and most likely it looks like today that vote will last. Yesterday the Senate voted, and today the House is going to vote. I will say that we are absolutely going to need to continue to address this no matter what. And looking today at the state, I was actually struck by the numbers. To answer your direct question, we don't know exactly how this will impact, and we can imagine that it's going to continue to be an uphill battle for us as it already has been. We've seen these numbers that we have. The perception of harm issue is something we're going to have to double down on. So I think, it's going to be an ongoing challenge for us for sure. Jen, let me just look in the chat too. Jen Jacobson.
Kathy, are the reports for everything up already, or have you not posted those yet? Are you waiting till after you're done presenting things to different bodies?
Yeah, I haven't posted them yet, but I will.
Okay, thanks.
And actually, if there are no other questions, if I'm checking properly in our list, what I do want to, speaking of, this is something I should have said in our in the co-chair update. And if there are no other questions, I'm going to move this into the next item on the agenda. We're going to move on from the parent survey because we're going to take time in the fall, as Kathy said, to do that. And looking at revising the coalition meeting, item number 7. So I'm just going to take this opportunity to talk a little bit about the Freedom of Information Act and how process works. I've spent a lot of time in the past few weeks with that law and with process here at the state level because of my role as a committee chair. Today, if one of the 2 bills that we're voting on today passes, we will then have the ability to continue to do Zoom meetings. If the bill for some reason does not pass, that ability is going to end. And what will change though for the Zoom meetings, if the bill passes, is that any materials that are presented, and this would be true, Mr. Cummings and Board of Ed and others could take note, materials will be required to be posted ahead of the meeting so that people have them, if there's an internet website available, posted ahead of time. We are not able to revise our schedule. The Freedom of Information Law requires that we post our meetings and publish them in January for our regular meetings. Special meetings, we can notice 24 hours ahead. But all that is to say, I think Kathy and I talked about this. What we usually do is we go ahead and schedule a monthly meeting for each of them and then choose to cancel usually our July meeting. So that's really what we were talking about with this, is that Traditionally, we do not meet in July unless necessary. There have been times over the years we have, but the plan would be to not meet in July and to come back then. And Kathy, you want to chime in on that?
Yeah, that was, I guess, a poor choice of words. We had identified meetings for both July and August. So it was really just about agreeing that we're not going to meet in July. And I guess the question is, can people meet in August? So it would be that, the third Wednesday. I don't know the date off the top of my head.
I was going to actually ask Riney for the date that we did decide on in August.
July, we have
We're not gonna meet in
July 21st, which we might have to then move to August because we had no meeting set in August. The third Wednesday of August is August 18th, and actually we do have a meeting there. I just couldn't see it on my calendar. We have the meeting set for August 18th.
Right, that's the third.
Yes.
Okay.
Yes.
Well, what I would suggest at this point is that we plan to cancel our July meeting, which we would need to notice. And then we can, most likely we will not meet the 18th. However, because sometimes things evolve, it's probably best if we don't cancel it right now and just leave that available to us. We can cancel it 24 hours ahead of the meeting if need be. But the next meeting after the 18th is, I don't have that in front of me either. I'm going to call out for a lifeline, Riney.
Yeah, in September, we have our meeting actually on the fourth Wednesday of the month because that's the 22nd. So that's what we had chosen because, the first is a Wednesday. And so it really is almost like the third Wednesday, but we had it set on September 22nd.
Okay, so I think at this point, we should probably leave the 18th just in the event that we need it. And again, we can always call a special meeting as long as we have notice in place. Again, if it's a Zoom meeting with the new law, there will be additional requirements for us. We will have to at least notify 48 hours in advance that it's an electronic or Zoom meeting, but the agenda still only would need to be posted 24 hours in advance. So by then, we could be meeting in person as well. So we'll have to look at our locations, but that's just a little bit of fun freedom of information facts for you. And is there anything else you want to add on that, Kathy? I see, there you go.
Just, does it make sense to just query the folks who are on the meeting right now to see if that August date would work? I mean, are people going to be vacationing toward the end of August, or will people be around?
So why don't we do this? If maybe, yes, the thumbs up if you're, or a physical thumbs up if you're able to.
I can do August 18th, if you can do August 18th.
See a bunch of thumbs up.
Yeah.
Yay, yay.
All
Oh,
right.
it's nice to see.
Okay. Okay.
Yeah,
For
Vicky,
those
it's
that
nice.
I can see, it looks like it's a go. Okay.
For some reason, I had lost you for a minute there, Vicky. I see you back. Okay, cool. Thank you very much. All right, let's move on to item number 8, which is planning for one fundraising event for the coalition. Kathy.
Okay. So this is all about sustainability, folks. And down the road, I mean, let's all think positive. We're going to get that drug-free communities grant, right? We already have to provide matching. It's a 1-to-1 match. We're able to do that, but that match requirement is going to increase. So that's one reason why we want to start fundraising now. The other is, our budget is actually could be more than what we get from grants. Right now we have no discretionary funds. We have to purchase and do based on what our grants tell us and what the budgets of grants provide for us. It would be great if we had some discretionary funds. And, you know, we were able to make some money through our Fairfield County Giving Day, yay, which was wonderful. My goal for our next fiscal year is to just add one more. We're going to continue to do the Giving Day. Just do one more fundraising for the coalition. And, you know, I'm hoping to draft a budget for leadership over the summer for them to take a look at so that we can realistically know, you know, how we want to operate. You know, we want to have funds to provide for Emily Melnick, who is our evaluator, and the Drug Free Communities Grant, you know, provides us with so much, but we may want to use it for other things as well. So it might require more time. You know, we may want to invite a speaker when we're all back together again. You know, that's going to cost money. We may not have that in any other budget. So I think it's important that we do some fundraising, and there is that expectation from the Drug Free Communities Grant as well. We would not necessarily be starting from scratch. Ryan and I have been kind of, you know, stewing over this and talking about it, but Riney does a lot. So I don't want Riney to be involved because she already does so much for this coalition. I would love to have, though, a small group of people who would be willing to do an event, to help plan the event, to help implement the event. You know, I have a couple ideas, but I'm open to other ideas. So
Kathy, if I may jump in, so fundraising, F-U-N, and fund, F-U-N-D, raising.
Yes.
It sounds to me like what you're thinking about is a community building event, but that is also an actual fund, F-U-N-D, raiser.
Absolutely.
And in that case, I would suggest our resource committee would be probably a good place to start with this, but I think it's great to be putting the idea on the table for all of us to think about. And I think about the Milford Coalition over the years has done a number of different events in the community that have been fundraisers, but also fundraisers and community awareness events. They've had superhero runs. They've had different events where, and I can't remember, some kind of community arts where kids put different things in the community and people, I see Mr. Cummings, you might remember better than I do, and others might. Ryan,
Last winter they had a snowman event, which I think was actually quite genius. Basically, it was lawn signs cut out as a snowman, and then people purchased them and decorated them, and they put them on the Milford Green. That was just a genius event, and that's something to really easily copy and flatter them by copying it.
Exactly.
Mr. Cummings, were you going to chime in?
Randy, I call that liberation. I call when you take a good idea, you're liberating that idea. They've also, they've worked with each of the schools. For example, they got one time the foundation that supports the school system is already using this idea, but this actually started with drug prevention, Drug Free Milford. The tech department in the schools crafted Adirondack chairs. They then gave each Adirondack chair to one of the elementary schools, middle schools, high schools, and then the students decorated it, and then they auctioned those off. They put them around town, for example, in different places to draw interest, and then people they had an auctioning event. So they've done that with a couple of different items over the years. So yeah, they're very active in that type of thing.
Thank you for that. I knew there was something like that and I couldn't quite remember. Yes, that's great because it also engaged the young people in it. And yeah, so I think those are some really great ideas, and I love the liberation concept. That's wonderful. So
no, I talked to Harper Teshuk. Do you know her, Mike? From she's the head of the Key Club at Ludlow.
No.
She came to me, actually, she is, so all these kids are obviously high school students for the Key Club from Kiwanis, and they do fundraising and projects all year long. I think they did 30 of them last year. And she did say to me she would be willing to, work with the coalition to try to, raise awareness. So maybe I can reach out to her and see, if they have some ideas that I would bring to you and see what you thought of them. But she went to the parade. She was the only teenager there, but she went to the parade with the Kiwanis. She's a wonderful person.
That's phenomenal.
So while it does fit with the resources committee, we're going to be reconstituting, I think, our committees next year. So we do want everybody to be active in a committee. So this is something that, it'd be great to begin thinking about. So it'd be wonderful if there were just a group of folks who would be willing to, and I'd be happy to meet with them too, to kind of begin to flesh out some ideas that we can then present, come back to the coalition and leadership with, to say, yeah, that sounds like a great idea. Let's do that one. So
wonderful. It sounds like we have some good options right here, and Vicky's offer to connect, I think it was Harper, is phenomenal also. So we will hopefully make those connections, and with Kathy and the resource committee move forward. It definitely behooves us to both fundraise and raise awareness in the community. It's wonderful. So number 9 on our agenda is advocacy group to consider cannabis policy. And as Kathy and I talked yesterday, we missed each other before. Want to talk a little bit broader, actually. We talked earlier in the meeting about the importance of having conversation related to cannabis, but as we looked at data, we know that we have advocacy that we need to do on a number of different fronts, including those substances that we saw in our survey. We also have issues around suicide prevention that are outstanding for us, gaming, and a number of other things. So we want to talk a little bit about steps moving forward with. It's great that we've spent time, and thanks to everyone who helped with our advocacy policy. We know that we want to be intentional about our work and be able to make an impact in the community and give voice to what we're seeing, again, based on our experiences and the data that we have. So Kathy, I'll turn it to you for some conversation about that and then open it up to the group.
yeah, so as we've shared the past few coalition meetings, the idea with having a task force really to come together over the summer to discuss topics that we as a coalition might want to take a position on. And so given that this is technically the last meeting of our fiscal year, it seemed to be the right time to just approach the subject about bringing together a few folks who might be interested in taking a look at different topics, considering what positions the coalition may want to take or might want to be involved in, and and cannabis has been on my mind, just because of the legislation, but absolutely other topics as well. Suicide prevention. We experienced more than one suicide this past year, right? And so that is definitely an area that, while we have a post-vention group that addresses that, there's still maybe something more in a position that we want the coalition to have regarding that. Other topics as well. So I just wanted to just mention this, bring this up, throw it out as far as, topic of conversation. You know, from all of you, are there things that you want to be more engaged in, would love to see the coalition take a position on? What are your thoughts?
And yeah, I thank you for opening that up. Again, not to be too formal, but just because of ease for anyone who might watch this in the future. I know there might only be a few people, but just if we can speak one at a time and use either raise your hand physically or use that function in the chat to raise hands. But I'm looking to see if Bill Dwyer, thank you for using that.
I just want to prove that I figured it out after 1,000 Zoom meetings. I think we just passed the policy, and I think we've missed an opportunity to tell everybody in advance to think about what the issues are and come prepared in June at the meeting to throw out ideas, which was the concept behind the policy. I'm wondering if we can't ensure that we have that step. If we send out a little doodle survey to all of the coalition members, so that we don't have just a small group looking at different issues, but we give a formal way for everybody on the coalition to say, this is an issue I feel passionately about, and I think the coalition should talk about it and do something about it. So that it's a broader based idea, so that we kind of follow what the policy says. If not in person, we do it through Doodle. Having said that, the item that showed up in the agenda surprised me a little bit, but the way I hear both Kristen and Kathy talking at the moment, whether we like it or not, across the country, the attitude toward marijuana and recreational use is changing and is being approved one state after another. Whether we like it or not, it's happening. I think what would be good, because we, in our essence, we are a program service delivery agency. We didn't start out as an advocate group. We started out and have maintained ourselves as serving the needs of youth. I wouldn't mind at all over the summer saying, now that the policy is in place in the state, assuming the vote and the governor doesn't veto and all those other political games, what is our planning? What is our approach now that it's happened? How are we going to adjust our programs? How are we going to change what we're doing in order to respond to the changing external environment? Having a small group talk about the program delivery side of it, as opposed to the policy side of it, to me does make sense. Those are my two comments.
Phil, thank you for that. And are there others who want to chime in? I have a response or reaction, but I would like to hear from others first. Well, feel free to chime in. I'll chime in now, and if others have thoughts. You know, one option is to keep a July regular meeting date for anyone who is able to really focus just on this. But we also can very easily meet in a special meeting at just a time that works, or a small group can meet and talk. I think that, Phil, you raise a valid point in terms of doing some broader outreach beyond those of us who are here on the call. But we could certainly do, you know, a Survey Monkey or Doodle poll, simple. But what I would say is this, I think Kathy and I talked a little bit yesterday about how we do advocacy. We've talked about this in the past. One of the reasons that we haven't been really engaged in advocacy, whether it's regulatory advocacy, policy at the local level, state or federal, any of it is a lot about capacity and kind of matching those resources. So thinking about where there's low-hanging fruit for us to be able to engage in advocacy and matching that with where people's passion and interest is and seeing where we can be most effective. There's a lot of advocacy for us to do. And I do agree, Phil, I think, and like I said earlier, whatever happens with legislation, this year, we have our work cut out for us. So I think that this is something, even if it's not in a formal meeting and there are just, a small group of us gathered this summer, I think it does make sense to start to noodle through this a little more in depth for a number of different issues that we're facing. So any other thoughts?
There we go. I actually have a thought, and because
Rainey, if you can also, this is another one of those Zoom things. Sorry, Rainey.
yes, Rainey Noor. So, I keep thinking that we have to go further and further upstream, and part of because what we see our kids doing, they fill voids, they fill boredom, they fill voids in feeling, they want to numb feelings, they there's all these reasons why behind what they're doing, and it expresses itself in either self-medicating or gambling or watching porn or this or that. And I keep feeling that we have to go further upstream, and we have to advocate for funds to have meaningful activities for our teens in our town so that they don't have these voids. We have to have, catch them early so mental health issues are addressed before the self-medication starts. So I feel that's where I would love this coalition to go in the future, to really go upstream and really look at preventing and not catching. So this is where I would really love to focus energy, and working with Parks and Rec, and really, people complain about kids at the beach running into events and, stealing food from people's buffets that they have at the pavilion. These are all this kind of a different expression of the same symptoms. So I would really love to be able to meaningfully get these kids help.
Rainey, thank you. I think it sounds like Kathy and maybe you agree that a group of us should do some work this summer to see where folks are and then be able to come back with some options to start our new year. And I see, I'm realizing as people are dropping off in time, I have lost track of time this June, but I know we have a few more items on the agenda, and I'm going to move fairly quickly through them, because one of the ones that I forgot at the beginning of the agenda was our minutes from the last meeting. And I'm wondering if we can do a quick motion to approve those minutes. I see Phil Dwyer is raising his hand to make a motion, and Wendy is seconding. Is there any discussion on the minutes at all? I see no discussion. All in favor? Anyone opposed? I see thumbs up. And I'm going to abstain from the minutes. But the minutes are approved. So thank you for moving us through that process so we can get those approved minutes up on the town website too. Item 10, we have two more agenda items, and committee and grant updates. Maybe if we can do speed round of that, and then any announcements from coalition members. So committee and grant updates. Who would like to start that? Phil Dwyer?
On the resource committee, my 40-year focus has always been on turning to people like Bernadette, telling her my story and asking her for a donation to the cause. While I know how to run special events, it's not my expertise nor frankly my big interest. And so I would encourage any of you who have an interest in running friend-raising events, fundraising events, special events of any kind, please sign up to join the resource committee so that we have people who can follow through on Kathy's suggestion. Agencies do have to do both. They do have to do both. At some point, I have to ask Riney, would you make a personal donation to Fairfield Cares? And at some point, 100% of the coalition members should be making a personal donation to an agency they believe in. But we have to gain new friends, and that frequently is done through special events. So both are important. So those who are interested in special events, especially, join the committee. I'm done.
Great, that was perfect. Other updates or committee news, Bryony?
Yes, hi, this is Ronnie from programming, and I also work on the SOR grant. I'm going to flip myself over so you can all see the wonderful tags in my background. And we have these now, and too bad Mike had to leave because I wanted to get his okay to set them up when we have open houses in the fall, and also maybe use them at other school events, so where people go because they go and not because they might see us there. And so these are actually, they were funded through our SOR grant that's currently happening. And then we also still have a small tiny grant of $750 for a alcohol community talk event that we can use over the summer. And we will be having a International Overdose Awareness Day vigil again, in person again, which is, you know, it's a sad reason, but it's so necessary because overdose deaths have skyrocketed through the pandemic, and it's heartbreaking, you know, what's happening. So I think it's very important to come together for that, and that will be a big focus of my planning over the summer, to have a meaningful vigil taking place. And that's my update for today.
Bryony, thank you so much. That's, I mean, you're absolutely right. It is sad, but I'm also incredibly grateful we have that opportunity. Do you know the date for that offhand so that we can all put that on our calendars and see if we're...
Kathy has the date. It's around August 31st, but we have it okayed with Parks and Rec, and Kathy has the exact date.
All right, so I'm turning it over to Kathy.
It is August 31st. We've got it on the date.
Wonderful. Kathy, do you want to do any other updates before we close out?
Actually, not really. I mean, I shared the data, so consider that the data committee report. And with the CSC grant, that really is done. That grant ends June 30th. And yeah, that's about it. So.
And I see Wendy. Thank you, Kathy.
Sorry, Wendy Benevegna, couldn't find the raise hand fast enough, so I raised my hand. I just on the LPC grant, just to tidy things up, that is also, you know, over. We've pretty much, and I'm just working on the final report with Kathy to, and getting some input from Lori. So we'll have that ready to submit before the July 15th deadline. And Bernadette for help. Thank you for helping me with the budget, telling me what we have and have not spent. Anyway.
Thank you all for your continued work on this. And I will note that the CSC grant that and the partnership with Positive Directions that we have had has been really instrumental in getting us to the place where we are now, and the ability to provide or to apply to the federal drug-free communities couldn't have happened without that. So it's really tremendous. And the LPC funding, which are dollars that come from the state on an annual basis. We do anticipate continuing to receive. I continue to advocate for more of those dollars for communities like ours, but also across the state. So thank you very, very much. I will last end with item 11, which is announcements from coalition members. Feel free to use the plain old, actually raise your hand physically or either way. Are there any announcements? It looks like, oh, Donna. Oh, hi, Donna. And I apologize for not actually recognizing that Donna and Dana had joined us.
Oh,
good to
well,
see you.
I apologize because I joined a little late. I will be honest with you. So, but hi everyone. It's great to see everyone. I just wanted to announce that Child and Family Guidance Center is reopening its doors to clients to start doing some in-person sessions. We're doing gradual build, but we'll be available to do those sessions for, those youth who are using drugs and alcohol in the community, vaping, whatever it may be, and those kids struggling with substance use. So starting July 1st. So good news. We're coming back.
It's really wonderful to hear. Yeah,
Thank
you so much. And it's really great to have you, Donna, here with us, and Dana Basio from Fairfield Public Schools joining too.
Thank you, Kathy.
Any other announcements or introductions? That's what we say here in the legislature. It's funny. Announcements or introductions? If not, I am Bryony, go ahead.
Yes, there are two things. One is on, you will find the one item in our calendar for tomorrow evening. This is actually a presentation through Dana's office. And it's a Zoom presentation, Moving Forward with Hope. It's with Dr. Alison Roy from the Center for Trauma and Responsive Practice Change. You'll see the Zoom link on our calendar, and if I get it copied and pasted, I put it in the chat. And so people are welcome to attend this. And this is part of her season. She's been in Fairfield a few times and presented to our family. So share this with anybody who is looking for some pep talk about moving forward with tentative hope. And secondly, this is also tomorrow, but it's during the day. And this is organized by wonderful youth groups at Ward and Ludlow. It's the Fairfield Ward Voices for Equity and Ludlow's Youth for Equity, which are amazing asset builders in our town. And they're just fabulous. And they're having a Step into Summer get together tomorrow between 3 and 5 on the Ward turf. And all parents, students, and teachers are all welcome for a friendly get together to bring some yard games and have a couple snacks. And you need to bring your mask. Water will be provided, or snacks will be provided. Bring your own water. And if you have an extra special backyard game, bring that as well, and bring your friends. So it's open to all Fairfield Public School students, teachers, and parents. So I think that is just wonderful what they're doing.
I love, Bryony, that you highlighted our young people who have been absolutely right. You're so right to use that good Search Institute term, asset builders, but they're helping create community within their school community, but even beyond. Dana, did you want to add something? I saw you had unmuted.
Did I unmute? I don't think that I did, but I will add on. I appreciate Rhiney, and thank you for letting me, as always, be a little bit of a lurker in this last week of school. Lots of places and in lots of places, and really the function of tonight is an opportunity not just for our staff or our parents or the community, but for everyone to come together and kind of reflect on the last 15 months. Lots of hard-earned lessons, I think, and hopefully looking forward. And I'm really excited about the information from the survey, as well as some of the initiatives at the district level. I know the community is behind it. I think they're, I say tentatively hopeful because I do think we live in a really unique community, and frankly, the results of the survey really verified a lot of my kind of like musings. So I think we need all hands on deck. We all need to be connected in helping our kids feel good and take good care of themselves. And frankly, our adults too.
And we're in a community where we focus a lot on achievement. And we have to consider how do we embed all of this in what we do every day. It can't be an add-on. We need to make space for it. So that's what I'm going to say. That's it. That's all I've got to say at this moment. Just a lot of thinking.
Well, Dana, thank you for that, because what you're saying is absolutely critical. And as Bill was talking earlier, we are a programming organization, but it is more than just programming. When we talk about social norms and shifting attitudes and culture, it is about embedding these assets. It's about embedding the prevention measures and ways of approaching life into, what we do to support our young people and help them be healthy and stay safe. So I really appreciate that commentary. So we are so blessed and fortunate to have all of you here with us and continuing to come back and engage in this work. And I do think, more and more will be moving back. That's one of the things that the leadership group will be talking about too, is how we do our meetings in terms of, being able to offer. We know that the hybrid meeting approach, talk to any teacher who's done the dual teaching and how difficult it can be. But we also know that some folks are able to have access that way. So we'll have to figure that out in terms of what that means for us as a coalition too. And we'll be doing some talking about that. And obviously we leave this meeting with homework from some of our earlier agenda items. But Tuesday night, Dana and Kathy, I will be joining, and we'll have anyone is welcome in the Board of Education meeting to hear the conversation among our Board of Education members and the full presentation that Kathy has prepared for the board. And I think that's going to be another important milestone for us again. I can say that's how I started this journey. I was at a Board of Ed meeting, hearing the survey results presented. And Wendy and I were together soon after to talk about how we could take steps. So it's great to be together with all of you. Kathy, any final comments before we?
Just wanted to say how much I've appreciated. We've had terrific attendance this year, and I so appreciate everybody who's come to these meetings and involvement. It's been, I think, overall a good year for the coalition. We've accomplished a lot. We've done a lot of capacity building. We're kind of evolving into our next phase of sort of, organization, and that's exciting. And it involves everybody. So I want to thank you for your participation and your commitment to keeping our youth safe from drugs. I mean, that's the bottom line. So thank you.
Amen. Well, with no further business on our agenda, and given that it's now 10, our timing, I will take a motion to adjourn. Is there a motion to adjourn?
Motion to adjourn.
So moved by Riney.
Seconded by Wendy.
Seconded by Wendy. So we are adjourned. Thank you so much, everyone.